Hi, I'm Melanie Fritz, and I work at the University of Wisconsin as a general surgery resident. Today I'm going to demonstrate Better Conversations, a framework for surgical decision making. This framework has 4 steps. Step 1 is show your cards. The surgeon provides their initial inclination about surgery up front to prevent patients from having to guess what the surgeon is thinking. Step 2 is name the goal of surgery. Surgery can accomplish 4 goals: help patients to live longer, feel better, prevent a disability, or make a diagnosis. By explicitly stating at least one goal, surgeons say what surgery might accomplish and draw clear boundaries around what surgery can and cannot do. Step 3 is describe all the downsides of surgery. Consider that the bin of bad stuff has 3 layers. 1, bad things that happen to everyone who has surgery, like having to go through pain and recovery. 2, bad things that could happen, from minor bumps in the road to serious complications. And 3, surgery could fall short and not achieve the intended goal. Step 4 is to deliberate with the patient about the goals versus the downsides to make sure surgery is worth it to them. Finally, surgeons and patients come to an agreement and make a plan. Today, I'm speaking with a patient who has symptoms consistent with biliary colic, imaging supporting the diagnosis, and is generally healthy, a patient for whom we would typically do a cholecystectomy. We are seeing this patient in clinic, but Better Conversations can be used in the emergency department or hospital or anywhere that surgery is discussed. I have already talked with her about her symptoms, examined her, and now we are ready to discuss surgery. So let's talk about what might be right for you. From what you're telling me, it does sound like your gallbladder is causing the pain you feel after eating fatty foods. Usually, we think about doing surgery for this.
Okay.
The main reason to do surgery is to help you feel better. Specifically, I think that taking out your gallbladder will help the pain you feel after eating. And if we decide not to do surgery, I do think you're likely to have this similar pain after eating greasy or fatty foods again. I'm not worried though that your gallbladder or gallstones are a threat to your life, and I think they're unlikely to cause serious problems in the future. Sometimes gallstones are dangerous, but only in a very small minority of people. And so really our main goal with doing surgery would be to help with the pain.
That sounds great.
Okay. So the surgery is one that we do commonly, but it's still something to go through, so let's talk about that. There's a few things that are pretty standard when someone has gallbladder surgery. You'll come to the hospital on the morning of surgery. The surgery doesn't take too long, about 1 to 2 hours, and you'll need to be totally asleep with a breathing tube during that time. After surgery, most people go home the same day. You won't be able to drive yourself though. The whole thing from getting to the hospital in the morning to leaving the hospital after surgery usually takes around 4 to 6 hours. Afterwards, you will have some pain on the muscles of your abdomen, usually right around here and here. So you'll want to take some ibuprofen and some Tylenol to help with that. Some people need a few pills of opioid medication to help with the pain, since you might feel very sore for a few days. Most people end up feeling pretty good by about a week after surgery, but some people can take a bit longer to recover. We make a few small incisions to do the surgery, and those will heal over the course of a couple of weeks, but you will have scars there. We use dissolvable sutures, so that means that you won't need stitches or staples removed after surgery.
Okay. How long do I need to take off work?
Usually people take 1 or 2 weeks off of work, although it depends a lot on the type of work you do and how you're feeling after surgery.
Okay. I don't think that should be a problem. Can I drive after surgery?
It's a great question. It depends on what you're taking for pain medication. The day of surgery, you'll be recovering from anesthesia, so you won't be able to drive. But after that, once your pain's under control and you aren't taking opioids, if you're feeling up to it, it's okay to drive.
Okay, that sounds good.
Okay. So that's what it looks like when things go smoothly, which they do most of the time. But sometimes bad or unpleasant things can happen when people have gallbladder surgery. Most often, these are things that will get better, but some problems are more serious than others. Sometimes there are bumps in the road. For example, it's not uncommon for people to have shoulder pain for a few days after surgery. Lots of people will have loose stools for some time after surgery. This could be weeks or even months. It's very annoying and it almost always gets better, although for some people their stools might not go back to how they were before surgery. There are other bumps like struggling to pee after surgery or feeling nauseated. All these things usually get better pretty quickly. We can almost always do surgery with the small incisions, like I mentioned, but in rare cases, we have to make a much larger incision to do the surgery safely. And if that were to happen, you'd have more pain, your recovery would be quite a bit longer, closer to 3 or 4 weeks. And we'd also want to keep you in the hospital for a few days to keep an eye on you and make sure that your pain's under control after surgery. Sometimes there are serious complications after surgery. These are rare, but they can have real consequences, like bleeding that requires another surgery or a blood transfusion, or an infection that needs antibiotics or more time in the hospital. Rarely, there can be serious damage to things around your gallbladder. The most worrisome is if there's an injury to the bile duct that goes from the liver to the intestines. This is very serious and often needs multiple other procedures or surgeries, but it's rare, less than 1 in 100. A small number of people also could get a serious and potentially life-threatening blood clot. And finally, every time we take someone to the operating room for surgery, we make them vulnerable to things we just can't predict, like an unexpected reaction to a medication or a numb spot on their leg from how they were positioned in the operating room.
Yeah, I understand that pretty much anything can happen and that you have to go over all of those things.
Okay. The last thing I want to mention is the chance that surgery doesn't do what we hope it will do. I feel very confident that this will help you feel better, but there's always a possibility that you go through all of this and you still have pain. And if that happens, then we'll know it wasn't your gallbladder, but it's a lot to go through and to not feel better.
Yeah, I really hope it's my gallbladder and I really hope you can help me.
Okay. Given all that we've just talked about, what do you think? How much is this bothering you, and is it worth it to go through all this?
Yeah, I mean, from my perspective, the pain is pretty bothersome. I can't eat what I want. And last week I missed going to a concert with my friends because I felt so crappy. And now I'm kind of avoiding going out or doing things because I don't want the pain to come back. So if there's any reasonable chance that it could be my gallbladder and that it'll take the pain away, I would like to proceed with surgery.
Okay. That makes a lot of sense to me. I do think we have a good chance of helping you feel better, and it sounds like this bothers you enough to want to go through with all that.
Yeah, absolutely.
Okay. What else can I tell you about our plan to do surgery?
No, I think you've gone over all of it, so nothing now.
Okay.
To review, in using the Better Conversations framework with this patient, we covered 4 key steps. For step 1, show your cards, I shared that we usually would do surgery to treat this patient's symptoms. For step 2, identify the goals of surgery, we discussed that the goal of surgery is to treat her pain. For step 3, discuss the downsides, we talked about bad things that happen to everyone, bad things that could happen, and the possibility that surgery doesn't meet her goals. For step 4, the patient deliberated about whether surgery was worth it to her. We came to an agreement and planned to move forward with surgery. For this demonstration, we cut out the history and physical exam to focus on the discussion about surgery. You'll notice that we didn't include a comprehensive description of biliary anatomy or describe the steps of the surgery. Although these details could certainly be shared with patients who ask about them, they are less useful for helping patients figure out if surgery is right for them. By focusing on the critical information patients need to weigh the goal of surgery with the downsides, we were able to efficiently move through the conversation and come to a decision with this patient. For more information, feel free to see our website, patientpreferences.org/betterconversations.